The legislature passed legislation which enables the Kansas University Hospital to become a public authority.
A special morning medical update is just ahead as we look back on our humble beginnings as a hospital in 1906 to the premier academic destination health system we are today. Good morning, I'm Jessica Lovell. Some things are simply worth celebrating, and that is what we are doing with you today. Why? Because 25 years ago at midnight tomorrow, something so remarkable happened it would change the future of what we now call the University of Kansas Health System. Here is the story as told by some of the people who lived the moment.
I am pleased to announce the creation of an independent public authority to operate the hospital portion of the University of Kansas Medical Center.
We were founded in 1906. By the mid-90s, we were a failing organization based on every metric that mattered. In 1998, we were reborn. Here is part of the story as told by those who had the courage to lay the groundwork for us to rewrite our history.
By 97, it was pretty obvious that the hospital was in some trouble. The reserves were about gone, and we even had staff telling us that within a year or so, you may have to consider subsidies for the hospital. Well, nothing gets the Ways and Means chairman's attention faster than that kind of talk. I was very willing to listen.
There were huge problems. It was the fiscal pressure that came about that was probably the leading drive to do something better than what we were doing, because what we were doing simply wasn't working.
Volume was declining. People in the community, when we surveyed, really didn't even know what KU Hospital was, if it existed, and if it existed, that you only went there if you had to. No one really wanted to go there.
It would take something extraordinary to preserve the hospital. We found it in a different organization, a different governance structure. We found it in a public authority.
We developed a model statute from looking at a lot of other organizations, and we presented it to the legislature in 1997, many of whom were hearing about the hospital situation for the first time. It passed in 1998.
There wasn't any doubt in my mind as a lifelong Kansan that we needed to keep the hospital going. It needed to survive and thrive. The question was how to do it. I had a lot of really, really fine people advising me that this was the right direction to go.
We also owed it to the citizens of Kansas, as well as our employees and our physicians, to change the course our hospital was on. We just needed a chance to operate differently.
The governor signed it on, I believe, the 17th of February, and we had 225 days then to create a completely new organization separate from the one that we were running, and we had to get it completed by the end of 1998, or else the deal was null and void, and we would have had to start over from scratch.
There are times when people ask me if I ever doubted that the hospital would make it. No, I never doubted it. There were times when I was just startled by the success and the way it was coming. There were several landmark things that occurred in the early years that I think put everything in place for where it is today.
During the first couple of years, there were several transactions that jump-started our journey. We bought our cancer program back from Salic, we created Jayhawk Primary Care, and we significantly enhanced our cardiovascular program by bringing a group of cardiologists and CT surgeons over from a local competitor.
At the same time, we focused on quality and patient satisfaction. We charged nursing with owning patient satisfaction and began our transformation of nursing through our magnet journey. Our vice chair of the board at the time, Dr. George Farha, reminded us every day that we were in business for one reason only, to take great care of our patients. He would often say,
"Patient doesn't care how much you know, till they know how much you care."
The strategy of leading with quality and service is a winning strategy, and that will continue to serve the health system well, and you are exporting it to new entities that the system is acquiring, and it's been great for the state of Kansas.
Well, I think everyone should be proud of the great turnaround that took place that has led to the success of the hospital. And the hospital is positioned better than any other hospital in this community and most places in the country for what lays ahead.
Our guiding formula, our focus on quality, service, and people, has driven our growth. We have the very best people, supported in the best and right way, and it is why remarkable things continue to happen. We're so grateful for all those people who, over the last 25 years, made this possible and who continue to support the health system and the patients we serve.
We've come a long way from those early days. We're proud, but we're never satisfied. Our vision is to lead the nation in caring, healing, teaching, and discovering. We are relentless in the pursuit of our vision. We will lead the nation.
Bob Page, President and CEO of the health system, joins us here in studio. Alongside with us is President of the Kansas City Division, Tammy Peterman. Hello to both of you. Hi.
Morning.
Good to see you. Also joining us is Chief Medical Officer Dr. Steve Stites. Good morning to you.
Good morning, ma'am.
And medical oncologist Dr. Gary Doolittle is joining us. He is also the medical director of the Masonic Cancer Alliance. Dr. Doolittle, great to have you. Becoming an independent authority was a huge undertaking with many levers, as we know, that had to be pulled. But this morning, our focus is on crucial decisions in patient care made over the past 25 years. And Bob, we saw in the video how it took legislative action to become an authority. So a question many might have is, what is an independent authority? How did that change everything?
Well, we don't have enough time to talk about what an independent authority is. Let me just give you a little bit of the backdrop. First 92 years of our existence, we were basically governed and managed through the university system. Good years, okay years, really bad years by the 90s. Had to change something, went through the legislation, created the public authority. Here's what it in essence did. It separated us, allowed us to create our own board of directors. It cut us loose, if you will, from the state. So while we used to have to go to the state to get certain approvals and things like that, it allowed us to have some freedom in there. We're still an agency of the state of Kansas, but we now act more independently than we did before. We have our own board of directors. We haven't gotten any money from the state of Kansas, so it was kind of a mixed bag. It was a leap of faith, but I think, as everybody would suggest, 25 years has been a pretty successful change.
For sure. And Tammy, in the video, we talk about Dr. George Farha being the father of our intense focus on patient care. For those who might not know, of course, Tammy is also a nurse, and her father was a doctor in a small community in the state of Kansas. Tammy, what was the culture back in 1998, and what is the culture of the health system now, would you say?
I think that's a great question, and really, Jess, we didn't ever talk about culture back then, but I can tell you there are a number of us who lived through this, and the culture at that point in time, I need to say we had great people. I think we had really good people, but we had a bad system. We didn't have the right resources, and we didn't have the right ability we didn't have the ability at all to make decisions that the organization needed to make to help improve care, because we didn't even have a board of directors. So we had to go to Topeka for simple things like pieces of equipment and making sure that we could do some of the things that we needed to do. So the culture wasn't at all what it is today. When we look at the culture today, it's pretty remarkable. We have great people. We have 17,000 employees. They all know the reason this organization exists is to provide great care and support to patients and their families. We're a collaborative organization. We focus on the right things. We focus on people, always starting with patients, but making sure we're focused on our staff and our physicians, and that people need to have the right resources and support to do their job. I think it's a very different place. You can feel it when you walk in the door. I walk in the door every morning and I know, wow, this is a place that does remarkable things every day for patients and families from across Kansas City, across Kansas, and across the country.
I want to bring in Dr. Stites because you were here 25 years ago.
Yes, I was.
Yes,
Maybe longer.
I remind you lovingly.
Thank you.
Tell us just kind of what you remember, the difference in culture back then to today.
Yeah, I would say to Tammy's point, there was no focus on culture. There was not really a focus on quality. And there wasn't any data to tell you if you were doing a good job or not. We all thought we were doing a great job because we thought we were doing a great job. But man, our patients told us we weren't doing a good job because the number of patients we had kept declining. 1998, I think our average daily census was about 145 patients. Mind you, we had 175 medical students who needed to work with different patients. That number just didn't work. And the truth is we were not sustainable, and we all knew it because we could feel it starting to come apart.
So Bob, we talk about patient care, but your strengths are obviously on the financial and business side of healthcare. How did you feel back then, having to kind of put that focus on patient care when financially we know that the health system was on life support? Did it feel like attention should be paid more to the financial side?
You know, Jess, it really didn't. I mean, if you think about it, we asked ourselves one question: what business are we in? The answer is we're in the business of taking care of patients. And then you go, okay, so why do folks like Tammy Peterman and Steve Stites, why did they come into healthcare in the first place? And I know I'm a CPA, but the thought was, well, they probably come in because what they want to do is make sure every night when they go home, they feel comfortable that they provided the best care and service to every patient that they took care of that day. And so when you looked at what our metrics were, we had the worst patient satisfaction in the country. It was a no-brainer, quite frankly. It was like, well, let's start there. And so we started to build on the momentum, and then we added quality to that. And what you could see as quickly as patient sat went up, quality got better, finances improved. So I get it, I'm a numbers guy, but at the end of the day, you figure out what core business you're in, and then you think about why people come to work, and it was pretty easy to make that call.
Makes sense. Let's bring in one of our other physicians, medical oncologist, Dr. Gary Doolittle. This question's for you. A significant change occurred when the hospital broke ties with SALIC, a chain of cancer centers, and then the health system acquired Kansas City Cancer Centers. And Dr. Doolittle, you were a part of the hospital back then. How did those two big moments change the trajectory of cancer care as we know it?
Really good question. Two pivotal moments. SALIC, the whole SALIC venture was to try to make the patient experience more positive. And going into that was the hope. As it turned out, they were a for-profit entity. And some of the reinvestment that we'd hoped for into the cancer program was not realized. With respect to the Kansas City Cancer Centers, they would not have wanted to partner with us in 2000 and in the time of the SALIC era, because our program, quite honestly, was weak. We didn't have many faculty. We didn't have that many patients. So once again, the health system stepped up. They opened up the Westwood campus, which really provided an amazing outpatient experience for cancer patients. It allowed us to team together different groups, surgeons, medical oncologists together in the same unit. And as that grew and as more patients came to KU, then the Kansas City Cancer Centers started to take notice and were actually interested in partnering and coming to KU. And that was pivotal because not only were they excellent clinicians, but they also had offices that were sprinkled throughout the Kansas City area, and the footprint went beyond the main campus. All of that came together to help support NCI designation, which was just so important for our organization. When the NCI designates a medical center as an NCI designated center, it's really the stamp of approval. It's like the gold standard for cancer care. And all of this growth and infrastructure building had to occur before we were going to become designated. And then just most recently, we have the top gold standard in that we're now a comprehensive cancer center as designated by the NCI.
And now we have the Proton Center that was open in 2022, already serving hundreds of patients so far. And Dr. Doolittle, just from a medical perspective, what does this center mean for patients?
There's a couple take-homes for patients. I mean, it's a very unique form of radiation therapy. There are maybe 40 units in the country. For patients that are candidates for this type of radiation, this means traveling to a center closer to home. It is a superior form of radiation for certain types of cancer. I would much rather drive from western Kansas to Kansas City to get my proton therapy than have to go across the country to access a unit. And the other thing that I think is, again, really important, These are the kinds of things that comprehensive cancer centers offer. And this really indicates that the health system was willing to make a major investment, I mean major investment, in the care of the cancer patient. Why? So we have really comprehensive care, and so patients can get their care as close to home as possible.
In 2001, a pivotal moment happened when the Mid-America Cardiology and Mid-America Thoracic and Cardiovascular surgeons moved as a group to the hospital. Cardio-oncologist Dr. Charlie Porter was part of that group, and he is still with the health system today. He could not be here with us this morning because he is teaching at an international conference right now. But before he left, we asked him about his memories of that time.
And one of the things that gets lost in the shuffle is the fact that it was a homecoming, because both MAC Cardiology Group and MATCS Surgical Group had been founded by people who had originally been at KU, went elsewhere to try to build their careers in a way that fit their current vision, and then built groups that were ready to come back to KU when KU had a chance to really become the greatest cardiovascular center in the region. MAC had started out by two really fine people who built an attitude of compassionate professionalism, where it was patient-centered, focused on what's good for the patient and the family, but the professionalism in delivering the highest, most advanced, best care to get the best outcomes in patients and families who were highly satisfied with the way they were treated. It's just been really fun to be on the ride with it.
So, Bob, in 2006, the Center for Advanced Healthcare opened. It was a nearly $28 million expansion that included a new outpatient cardiology center, new catheterization labs, a new coronary unit, operating suites, a lot of growth and expense within a few short years of becoming the authority. What made this possible?
Well, let's put it in perspective. Think about it. The seed money that got the authority started was $23 million, and now we're talking about building a building that's more than the seed money we had. When I first arrived here, I was struck. I had come from St. Louis, and we had 3 cardiologists in our cardiovascular program. We really didn't have a surgery program. We were sending surgical patients who needed open heart surgery to a community hospital. And so I think it was a stroke of genius to bring over a group of surgeons and cardiologists. What we had to prove, though, that move was going to be successful. We had to prove it was the right group. We had to prove we could retain and then grow patient population. So we didn't build the building day one. What we wanted to do is see if we truly could meet our vision to become a world-class cardiovascular program. And we saw that trajectory going in the right direction, and so it made perfect sense to then build a new building so that we would have the opportunity to take care of that growing population of cardiovascular patients. The thing I do want to add, though, is it's not just about the cardiovascular department, because when you think about heart patients, it takes an entire team of people to surround those patients and provide the great care, and we had that here as well. So it was fun to watch that entire team come together, and I tell you what, today we've got one of the world-class cardiovascular programs in the country.
Indeed. So that happens in 2006. Tammy, also, the hospital earned its first magnet designation. We also earned redesignation in 2011, 2016, again in 2021. So what does this magnet designation really mean? Why has it been so important for patient care?
Sure. I think we need to go all the way back and think about why we even started this journey. Back in the early 2000s, in 2002, when we actually started thinking about magnet, nursing wasn't the same at all as it is today. We knew that we needed to increase the bar in terms of the nursing at our organization, and we knew that there were a lot of things we needed to do. We were also turning our workforce over quite a bit. You know, in the late 90s and early 2000s, our workforce was turning over about 33% a year. Same for nursing. We were training a lot of nurses here. They were getting oriented. They would stay here, learn a lot, and then they would go other places. We knew we had to have something that would keep people at our place, and part of that was making sure we had the right culture, the right environment, the right work environment, and work relationships. That started with this magnet journey. Back in 2002, we applied, and we sent our document in 2006 and became designated for the first time in 2006. Here's what I think magnet is. It's a designation for nursing excellence. Of course it is. It's a designation given by the American Nurse Credentialing Center. It's about nursing excellence. But at our place, we know it takes an entire team to provide great care to patients, and that's that's why we call it magnet at our hospital, not just magnet nursing, because we know that we have to, it's a team sport here at our place. But I do believe, and I do know, that you cannot have a great hospital without great nursing. And we have a great hospital, and we have great nurses. They are well educated, they're professional, they're collaborative, they work well with the medical staff. There are 1,000 reasons that we have a great hospital and great nursing, and those are just a few.
I don't think we've had a physician on here that hasn't given all the love and credit to our nursing staff here at the health system. And of course, while nursing was rapidly evolving, so was transplantation. Here's a look at solid organ transplants by the numbers. Kidney transplant dates back to 1969, and to date, we have transplanted 3,267 kidneys, of which 537 have been living donor kidneys. Liver transplant began in 1990, and we have transplanted 1,835 livers. We expect to begin living liver donations after the first of the year. We performed 3,473 renal pancreas transplants, of which 19 were pancreas-only transplants. We've transplanted 216 hearts and implanted 272 ventricular assist devices, which are considered a bridge to transplant. Dr. Tim Schmidt is our director of transplantation. He could not be here this morning, but he did look back on the growth of transplantation here at the health system.
I wish I could be there, but I have my daughter's wedding, and I'm grateful for the invite, but I'm going to participate in my family event this weekend. I'm glad to be here and talk about the University of Kansas Health System and all the great medical achievements we've done so far. We have heart transplant, liver transplant, pancreas transplant, kidney transplant, and we're currently the only transplant center in the state of Kansas. In 2011, when I first joined the health system, we had 6 separate areas where patients were seen, 6 different offices, and we consolidated that into a transplant center where now we have kidney patients there, liver patients, kidney pancreas patients, heart patients. People who have cancer of the liver and the pancreas also come to that. And I was thinking about that the other day. We had a small team, small coordinator number, but now for our liver transplant selection meeting, 100 people get the invite to that meeting. And so there are 100 people discussing one person at a time to look at them from heart, lung, are they going to be a good surgical candidate, medical candidate, socialize, their social structure. There's so many different people that care about each patient that wasn't available back in 2011. We've grown, we've expanded, we do way more volume of transplant, but also higher acuity. Patients are sicker, and we're expanding into different programs like chains for kidney transplant. We're probably going to start our living donor liver transplant program in the next few months. Lung transplant will be in the near future, but this is where the top programs are going, to do multi-organ transplants. High acuity patients and people who would not otherwise survive will survive here. I have a stack of papers that keeps growing in my office. Each one is an individual patient that I've operated on the year now. And I think each one of those pieces of paper has a story. This guy wouldn't have survived without this operation. This person wouldn't have been able to go to their event without this operation. And each patient has a story, but each patient also has a whole team behind them. And I think being a part of the team really is more of, than the individual achievements that really keeps us coming to work.
Lots of lives saved through transplant. I guess it depicted in that huge stack of papers. I love seeing that. So hopefully we'll double that in the next 25 years and beyond. Bob and Tammy, in 2014, another notable patient care moment happened when the Center for Medicare and Medicaid Services awarded a $12.5 million grant to help reduce heart attacks and strokes in the state of Kansas. That program has grown into the Care Collaborative with now 81 members in 72 counties. How does this live up to Simeon Bell's dream of caring for Kansans?
I think pretty simply, it's just that with additional resources and support given to so many areas across the state of Kansas, we are impacting the health of Kansans. That's what this wonderful collaborative is doing.
Bob?
You know, Jess, one of the lines in the document that created us, the public authority legislation, says something to the effect of the University of Kansas Hospital is responsible to provide care and service not readily available anywhere else. We've taken that to heart. I think the Care Collaborative is a perfect example of our commitment to the state of Kansas.
Dr. Stites, I want to bring you in right now because we invited you to talk about clinical integration. In 2016, we brought all physicians together and they became one big group with the health system. We know this is kind of a little inside baseball, if you will, because it involves the hospital structure, but this was considered a huge step in providing even higher quality of patient care. Why is that?
You know, Jess, a couple of thoughts. So first, in 1998, we had great physicians, we had a great team of people, but we didn't have a great system of care. And so the authority launched that. And then in 2016, we had a great hospital, but the medical staff was a little more disorganized because every department here was actually a company. And as a company, I could go do what I wanted. And so in truth, there were like 22 CEOs on the campus. Every company could go build their own building and have their own strategy. It's hard to say you're a system then. We really weren't. We were a hospital and a bunch of departments. Today, what we did is back in 16, we took all those departments, and it was a long journey to get there. We combined them into one group that became part of a health system, reporting up to the CEO and the authority. So at the end of the day, that was a momentous achievement for us because it set us on a journey that said the medical staff was now completely tied into the system, and it let the university focus on on research and education and not have to focus on patient care. So it was a momentous achievement for us, and I really think it was part of the trajectory of growth we've experienced since then.
Thank you for sharing that. We know there's so many more outstanding moments in healthcare here at the health system. It has truly been hard to just highlight a few of those, but our program is only so long, and we do want to get to some community questions this morning. You can use the chat on YouTube or Facebook. You can email us at the Medical News Network. Go ahead and get those sent in. As those questions start to come in, though, I do want to ask Bob and Tammy and Dr. Stites, if you have one favorite moment in this 25-year journey that kind of eclipses all. We know they're all great, but if you could pick one as far as making strides in patient care, what would that be? Who wants to go first?
I think that's a really hard question, Jess.
I knew you were going to say that.
I don't think there's just one. I think there are many, and we've talked about some of them already today. I was thinking about this earlier. One of the things that we did was implement a rapid response team that I believe served as a bit of a catalyst to help improve quality at our place. It also served as a model for many other response teams, meaning getting experts and resources at the patient, wherever the patient is, whether it's the bedside or it's somewhere else, it's in the clinic. We have 10 response teams now that help meet the needs of patients that have changed in condition or that we just need to put additional resources at the bedside of that patient. Those response teams, I think, have done a remarkable job at our hospital, and we have outstanding quality as a result of many things, including response teams.
All of the moments and milestones, Tammy, for you are like your children. I know you can never just pick one,
right.
So I won't make you do that. Dr. Stites, what's that one moment
it's not
you think
one
of?
single moment, although I would say of all the things we've talked about today, it was a magnet journey that made the biggest difference to our patients, to our hospital. But I think it's the way we focused on quality. You know, we all thought we were pretty hot stuff back in the ICU back in the day, but what we learned is our observed or predicted mortality was actually bad. It was 1.5 or 1.6. I saw some data just yesterday. It's 0.44. That is so much better. But we didn't know that because we didn't have good data. And the focus on quality data, the unrelenting focus on quality has made such a difference in everybody's lives. I just think that's a big part, and I think Magnet made it all possible.
I do want to just read some comments, though. Paul says, I was there a few days. The culture is exceptional. The nursing is absolutely brilliant. So thankful for the care I received. I immediately noticed the unique culture. Indeed, something you didn't really think would stand out, and it's risen to the top. Bob, what stands out for you?
So, again, it's hard to ask this group identify one thing, right? But I'm going to brag on our buddy over here, Steve. I remember early on, we didn't have a hospitalist program. And so there was all this discussion. It was kind of a new thing in healthcare, and people were going out and they were contracting with hospitalists. And I remember having a conversation with Steve, who was in the pulmonary division at the time, and he said, why don't we step up? And so actually it was the pulmonary division at that time that introduced the hospitalist program to the University of Kansas Hospital. Today, Steve, I don't know how many hospitalists we have. But
yeah, there's like 100.
There's like 100 of them. And it started out with a group of people, and it's back to Steve's point. We We have great physicians here in 1998, and they stepped up in really creative ways, much like they did with the rapid response teams.
Just going to tell one quick story.
Yeah,
Okay,
please.
what Bob didn't tell you is that conversation, oh, Eileen didn't, sorry. That conversation took place over in his office at the time, which is in an older part of this place, and there was a window unit that had air conditioning and pigeons in it. And so when you met with Bob, you wanted to wear like a whole suit and a face mask because you never knew what was coming out of that office. Things are a little better now.
That was really appreciated, yeah.
I bet. Margaret is asking, what can the community do to help keep the health system going at the pace it is? Is there anything people who are outside this health system can do?
Well, I have a couple thoughts. One, I would help us share the story. You know, it's really interesting because, quite frankly, as successful as we've been for 25 years, it still feels like a hidden gem. And we need all the people we can have on our team to talk about it. And the other thing, and I'm not really good at this, but I will tell you, these are the most difficult financial times in the history of healthcare. And so if people want to help us from a philanthropic standpoint, now's the time. We have a vision here that is unparalleled, and it's only possible because of what we've done for 25 years, but we're going to need help to make that vision a reality.
So I wanted to share something from Chesney. We've just made a scrapbook for my mom of the transformation of the burn unit from when she started in 1982 at KU Med to what it has turned into since 1998. The burn unit has only continued to be an incredible place that is now family. She's in her 41st year as a nurse at KU, working at the Cancer Center as a clinical nurse specialist. So just wanted to share that with you as well. So lots of comments of people just remembering what it was like. Lon wants to know what's next. Tammy, what do you think is next?
Well, I think there are a lot of things. I don't think we have enough time to talk about all the things that are what will next occur here. I think we'll continue to do the things that we've done, and we'll focus on quality and patient satisfaction. We'll make sure we have the right people. As people know, we've added Olathe Health and Miami County Medical Center to our health system. We'll continue to expand our reach through that partnership. I think there will be a lot of other things as we continue. As we think about some of the service lines such as cancer. You know, we're doing great things in that world, but we'll continue to expand in other areas as well. Precision medicine will be really, really important. Dr. Stites will probably mention that as well, knowing that's the future of medicine. I think there's some other things. We'll be really focusing on brain health as well. We know that there are some things we can do in that arena. I think sports medicine. We've done a lot of work in sports medicine, and there's some work we will continue to do in orthopedics and sports medicine and women's sports medicine. I think there are a lot of things we'll do in the future. Those are just a few of the things we'll be doing.
Dr. Doolittle, I want to get you in here on a comment from one of our viewers. I received chemo at Westwood, which is a very busy place, as we know. No matter how busy, I never felt like I was a number or I was just one of many. I felt as if I couldn't have been their only patient. I always felt safe and confident in the administration of my care. Thank you for taking the challenge 25 years ago and making this place so special. One of the best hospitals and cancer centers in the nation. Your reaction to that?
Well, obviously, it's so nice to hear because each and every one of us gets up every morning and we come to work with the idea that we want to provide the best possible care and patient experience. So obviously, it's really nice to get that kind of feedback. I think that really does, though, underscore the importance of the investment in the Westwood campus. That wasn't necessarily a popular decision among all at the time, but it was the right thing to do. It enabled all of us to really subspecialize in different cancer arenas. And the patient that just gave us that feedback has a specialist oncologist that is working on that specific type of cancer. So, and that would not have happened without the investment in Westwood. So, yeah, it's great feedback. It's nice to hear because that's what we're all about.
That's all right. Just a couple more. Jeremy wants to know, when you're talking about the health system to another expert or organization, and Bob, I know you hate this word, what do you find you brag about the most? And you've always said, we do not brag, but I think you know what he means.
Sure.
But,
although we do have that saying here, proud but never satisfied. But having said that, I think what we want people to understand the most is the patient experience and the quality is unparalleled. I mean, at the end of the day, you don't have to leave Kansas City for world-class care. That wasn't the case 25 years ago. It is absolutely the case today, and it's absolutely because we're here in Kansas City.
So Ruth Ellen, a faithful viewer of our show, I'm going to let her have the last word from our viewers, but she says, having lived in the area since the mid-'60s, I remember a time when KU Med didn't have a good reputation. People said it was full of medical students experimenting. So glad the past 25 years transformation. Today, my family knows if I needed a second opinion, they support my wish of going to KU healthcare system at any moment. So just lots of good comments from people who see the hard work over the last 25 years. So we know this has not been a usual morning medical update, and we thank you for just indulging us and celebrating some of these moments and milestones with us. I want to get our takeaways today. Dr. Doolittle, what do you want folks to take away from our talk today?
Just how proud I am to have been part of the Med Center, and what an amazing transformation. And as Dr. Porter had said, it wasn't the easiest place to come as a patient or a physician, and it's transformed into something truly exceptional.
Dr. Stites, what's the big takeaway?
You know, I think it's about privileges and blessings. You know, it is a privilege to be able to work here, to be surrounded with these great people, these great leaders, Bob, Tammy, our nursing staff, everyone. That's a privilege. It's a blessing to be able to bring my family here to get care, and to take myself here to get care, because this is the best care you can get anywhere. Privileges and blessings.
Well said. Bob, what's the takeaway?
You know, I'm going to go back to what I said earlier, which is you don't have to leave Kansas City for great care. What I want people to know is we are Kansas City. We are Kansas. We live here. We spend our money here. We invest our dollars here. We're committed to this community, and we're not going anywhere. We're here for the long haul, and we're excited about what the next 25 years holds.
Tammy, wrap us up with a takeaway.
Sure. I think this place is remarkable. It's special. You have to be here to feel it. But here's what I know. When people walk in our doors, people who've not been at our place, they tell us a few things. One is they say, people love what they do. They love the team they work with, and they love the place they work. I feel that every single day. I'm grateful for this place. We're a collaborative organization, and we're very proud of what happens here, but never satisfied. There's always more to do.
Love it. Thank you to all of our guests here on the panel today, and thanks to our viewers for being with us and asking your questions. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, I'm Jessica Lovell, and welcome to Pink Week, the first week in October dedicated to all things breast cancer. On Monday, we'll follow a woman getting her very first mammogram at age 40. She has a special reason for being screened and wanted to show how simple this life-saving test really is. Join us at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.